What key signs of osteoarthritis can X-ray images show? Imagine trying to see inside a joint without opening it up. That's what X-ray imaging allows doctors to do when diagnosing osteoarthritis. It's a simple, quick way to look at the bones and spot signs of wear and tear. Even though X-rays don't show cartilage directly, they reveal several clues that tell us osteoarthritis might be present. The most common sign is joint space narrowing. Think of the joint as a cushion of cartilage between bones. When cartilage wears away, the gap between the bones gets smaller on the X-ray. This narrowing is often uneven, especially in weight-bearing joints like the knees, where one side might show more wear than the other. Next, doctors look for osteophytes, which are tiny bone spurs. These are bony growths that develop at the edges of the joint as the body tries to repair damage. On an X-ray, osteophytes look like small projections sticking out from the bone margins. They're a clear sign that the joint has been affected over time. Another key feature is subchondral sclerosis. This term describes increased bone density just beneath the cartilage. When cartilage breaks down, the bone underneath takes on more stress, causing it to thicken and harden. On the X-ray, this appears as brighter or whiter areas under the joint surface. Doctors also look for subchondral cysts. These are fluid-filled cavities that, from within the bone beneath the cartilage. They develop in response to increased pressure and changes in joint mechanics. On the X-ray, subchondral cysts look like rounded dark spots inside the bone, often with a rim of increased density around them. In more advanced cases, X-rays may show joint deformities like bowing of the knee or even collapse of the joint surface. Sometimes, the joint may appear misaligned or shifted. However, complete fusion of the joint, known as ankylosis, is rare in osteoarthritis. To get the best view, X-rays are usually taken while the patient is standing. This weight-bearing position helps reveal the true extent of joint space narrowing that might not be visible if the joint is not under load. Standard views include front-to-back and side images, sometimes with angled shots for better detail. While X-rays are great for showing these bone changes, they are less sensitive in detecting early cartilage loss. For that, doctors might recommend magnetic resonance imaging, which can see soft tissues better. But for routine diagnosis and monitoring, X-ray imaging remains the main tool. In summary, X-ray images can reveal joint space narrowing, osteophytes, subchondral sclerosis, and subchondral cysts. These signs help confirm osteoarthritis, determine how severe it is, and guide treatment options. Knowing what to look for can help you understand your imaging reports and discuss your condition confidently with your healthcare provider.